Welcome to Frontline News from the University of Maryland School of Medicine News Center. I'm Larry Roberts. Coming up, launching a new center for violence prevention to save lives in Baltimore and beyond, plus the connection between blood type and strokes in young adults. But first, an updated COVID-19 booster vaccine is now available. With versions by Moderna and Pfizer, the boosters are bivalent. That means in addition to protecting against the original strain, they're specifically tailored to fight the highly contagious Omicron subvariants BA4 and BA5.
The thought process is to pattern things more closely to influenza vaccines, where we're trying to anticipate the circulating strain and target our boosters towards that specific strain. That was the idea behind the BA4-5 Omicron booster.
The Department of Family Medicine just received a large shipment of new booster doses and will begin vaccinating patients and students immediately. The new booster is for anyone over the age of 12 who has completed the primary vaccination series. Researchers hope the new bivalent boosters will last longer than the original boosters.
What we found is that the response to Omicron specifically was short-lived. And so you really saw this dramatic fall off in the response by day 91, so 3 months after you received the booster, as compared to the original ancestral strain. So we're hoping that with more focused Omicron-specific boosters, we'll have a longer-lived response.
Nationwide, fewer than half those eligible have received their first booster shot. The School of Medicine is leading a grassroots workforce to encourage people in vulnerable communities to get vaccinated and boosted.
The one thing we all need to remember is that the community is tired of COVID. They're exhausted. And when you say to them, there's one more booster, there is no hoops of joy. You know, they are looking at you like, really? I got my vaccination already. I'm done. But in talking with them and explaining how much Omicron is still there and how many people are still in the hospital, how many are dying, I think it does open a window or a little bit of an opportunity to now talk about the bivalent vaccine.
With the help of community partners, Dr. Khanna says the program has successfully vaccinated 13,000 people and educated more than 1 million people. Outside the R. Adams Cowley Shock Trauma Center, the University of Maryland, Baltimore launched the UMB Center for Violence Prevention, first by acknowledging the grim toll of gun violence in Baltimore.
If you'll notice on the tree behind me over there, there's a lot of orange ribbons. Those ribbons signify the hundreds of gun violence victims in this city of Baltimore in the past year.
Led by Dr. Tom Scalea, the center will focus on preventing gun violence in Baltimore and around the country.
The walk down to talk to a set of parents to tell them their kid's not coming home again, I can almost tell you the number of steps because I've had to do it way too many times.
For the first time last year in our history, more children under the age of 20 died of guns than traffic accidents. Since 2010, there's been more than a 50% increase in gun deaths in the state of Maryland alone.
Liza Hawley lost her only son to gun violence.
Parents are not supposed to bury their child, especially in a preventable death. After Deverell's death, I did not know how to move forward. I fell into a deep depression and did not think I had a way out.
Funded by a $2 million gift from Betsy Sherman and the Sherman Family Foundation, the center will take a multidisciplinary approach to violence prevention and advocate for policy change. Taking a research-based approach, the center will leverage expertise in the community and in UMB's professional schools to develop practical solutions.
Working collaboratively, partnering with those who are working in the community, whether it's law enforcement, BPD, UMB Police Department, whether it's Baltimore City Public Schools, whether it's the health department, all of these various units that are out there that we want to collaborate with.
But we hope it doesn't just stay on campus. We want this to grow and become a focal point for violence prevention efforts in a much, much larger way. And what I hope is some years from now, we'll look back on today and say, we began the new solution here on this corner.
In our Discovery segment, a new link has been found between blood type and the risk of stroke in younger adults. School of Medicine researchers found that people with early onset stroke before the age of 60 were more likely to have blood type A.
Well, first of all, we want to understand exactly why that is. And we think it's because blood type A marks a predisposition to clotting. And exactly how that works, we don't know.
Dr. Mitchell says the increased risk was very modest.
I'd like to stress that one thing people should not be worried about is if you have blood type A, you should not be worried about being at particularly high risk for stroke. There are many other risk factors for stroke that are modifiable, like hypertension and smoking. These risk factors are more important than blood group A. So if you really want to reduce your risk of stroke, those are the types of things that you want to focus on.
Dr. Mitchell says more research is needed to understand the mechanisms involved in the blood type connection to stroke. And that's Frontline News. I'm Larry Roberts. Thanks for joining us. We'll see you again next time.